Hello everyone, you're very welcome today to our lecture on blood pressure and exercise. This is presented to you today by Heart to Heart Cardiac Physiotherapy. My name is Karen Craddock, I'm a specialist cardiac physiotherapist. So we're going to start to have a look at some of the learning objectives from today. Initially we'll start to look at what does blood pressure look like in Ireland at the moment. We'll start to look at how blood pressure is measured. We'll also look at what is normal blood pressure. And then we'll start to look at what aspects of your lifestyle will impact on your blood pressure. We'll look at the implications of high blood pressure. And then lastly, we'll start to look at some exercise that will help you in your management of high blood pressure. So where does blood pressure stand here in Ireland at the moment? We start to see that overall half of adults in Ireland over 45 years of age have high blood pressure. We also see that 4 in every 5 men with high blood pressure are not being treated, and 2 in every 3 women with high blood pressure are not being treated. These are figures from the Irish Heart Foundation. So there are many methods of measuring blood pressure. So we have our manual cuff here, which we use in the sessions at Heart to Heart. We also see an automatic blood pressure, and we see a 24-hour blood pressure monitor. What you're looking at really with all of them is they all have pros and cons. Manual blood pressure is the most reliable, but is labour intensive. We also see the automatic blood pressure is quite reliable. The machine does have to be calibrated at regular intervals and certainly starts to go off kilter a little bit when the batteries start to run even slightly low. We see the 24-hour blood pressure monitor can be quite cumbersome to wear, but does give us night and daytime readings. Sometimes your cardiologist might request that you take 3 or 4 measures on your automatic blood pressure machine over the day. And this is just to monitor how the blood pressure changes throughout your day and might affect your dosage of medication. When we look at measuring blood pressure, we do look at 2 consecutive visits. So this actually we start to look a little bit at maybe white coat hypertension, and certainly the 24-hour blood pressure monitor will start to address that. So when we look at high blood pressure here in Ireland, we actually look at the European Society of Cardiology for our direction, and here are the guidelines that they created in 2018. So optimally we'd like a blood pressure less than 120 systolic and less than 80 diastolic. So we know that the systolic pressure actually is the squeeze action of the heart, so the amount of force the heart has to generate to squeeze the blood around the body to produce energy. And then the diastolic pressure is that state that the heart is left in relaxation state between each beat. We look at a normal range of 120 on 129 and or a diastolic of 80 to 84. A high normal would be 130 to 139 and or 85 to 89. We then move into grade 1, 2 and 3 hypertension, and we see the numbers graduating up, and these will require medical intervention. When we look at an isolated systolic hypertension, we look at greater than 140 systolic and less than 90 diastolic. When we look at the office and ambulatory readings, these are the readings that we look at. So an office blood pressure of greater than 140 and or greater than 90. We look at the ambulatory blood pressure, your daytime of greater than or equal to 135 systolic and or greater than or equal to 85 diastolic. We look at the 24-hour mean, it should be greater than or equal to 130 and or greater than or equal to 80. The home BP mean should be greater than or equal to 135 and or greater than or equal to 85 diastolic. So you can see it's quite a complex measurement. It does change throughout the day. It changes obviously with your activity, but really our target for you with heart disease is less than 120 on 80. Now there might be challenges in managing your blood pressure and you'll be working with your cardiology team with regard to that, but certainly here what we'll be looking at are the lifestyle considerations that you can help in your management of your overall blood pressure. So when we look at lifestyle and blood pressure, there are many things to consider that will contribute to your blood pressure management. We look at your salt intake. So in many of the processed foods that we eat today, there is a high salt intake within them. So the recommendation from the Heart Foundation at the moment is a salt intake of 5 grams per day. This is equal to 2 grams of sodium. And just to give you a little bit of context with regard to salt, 6 grams is equal to 1 teaspoon. It's important that you moderate your alcohol intake, and this would be slightly below the national recommendation if you have hypertension. So 12 units for men and 8 units for women, and obviously to include alcohol-free days. You'd like you to increase your fruit and vegetable intake, and to reach a normal body mass index, so less than 25 kilograms per meter squared. So for those of you who mightn't be familiar with the body mass index, this is your weight divided by your height squared. In fact, if you are overweight or obese, a 10% weight loss will make a significant difference to your blood pressure. Smoking cessation is obviously also important. We know that smoking damages the walls of the arteries and can contribute to high blood pressure. We know that aerobic and strength work and being generally active is important in the management of high blood pressure and will contribute to as much as a 10 millimeter mercury reduction in both your systolic and diastolic pressures. We know that anxiety contributes to blood pressure as well, and in these uncertain times during the COVID-19 virus, where we're all a little bit at sea, we can see we're uncertain as to our overall plan. This can cause increased anxiety and contribute to a higher blood pressure. So why is it important to manage high blood pressure? There are risks associated with it. So ischemic heart disease, so that increased pressure on the wall of the arteries can cause a breakdown on the endothelial wall and eventually lead to plaque formation. We look at both types of stroke, both hemorrhagic and ischemic. So hemorrhagic occurs when a blood vessel in your brain actually ruptures and causes a bleed directly into your brain tissue. And your ischemic stroke occurs similar to your ischemic heart disease, but this is within the arteries of the brain. We look at heart failure. So over a period of time, your heart muscle here will become dilated. This is your normal heart here on the left, and this here is myocardium, or heart muscle, that has been exposed to high levels of blood pressure over a period of time. We look at peripheral vascular disease. So this is similar as well to your ischemic heart disease and your ischemic stroke. This occurs in the arteries of the legs. We also look at the risk of atrial fibrillation with an associated high blood pressure. This is an irregular beat of the heart which can cause extreme fatigue and can be quite difficult to manage at times. So when we look at exercise and high blood pressure, we need to look at specifics around which exercises will assist you in the management of your hypertension. So we look at the differences between blood pressure response during arm and leg work. And we start to see that there's quite a considerable increase in blood pressure during arm work, which is different to that during leg work here. We also see a slight increase in the diastolic pressure during arm work with the lower limb exercise staying almost in stasis over time. So what we're looking at with the blood pressure response to exercise is that if you have hypertension, we will limit your arm work somewhat and concentrate mainly on the leg work. This can be counterintuitive, but it's important that you understand that. So when we look at exercise and blood pressure, we look at strengthening exercises and aerobic exercise. We look at the strength work, we look at isometric work. So this is holding your exercise for a period. So this is not recommended. This increases what we call the resistance within the arteries during the exercise and can further increase blood pressure. So we don't do any of this isometric work. It's keeping the muscle in the same length. So when we're exercising somebody with hypertension or with ischemic heart disease, it's really 3 seconds up and 3 seconds down with no hold. We lower the weights when you're using your upper limb, and remember the actual prescription remains the same, 10 to 15 repetitions 3 times per day, 3 days a week. So that's your strength work. We also look at your aerobic work. So we know the European Society of Cardiology recommends 30 minutes of exercise 5 to 7 days per week. But with established heart disease, we look at specific prescription. And this is what we maybe covered last week in the webinar. So your frequency really would have to be 3 to 5 days a week. and your intensity is as we discussed before. So what you're looking at is your 15-minute warm-up and then your sustained cardiovascular work for 20 to 60 minutes, working down then into a 10-minute cool down. So we know that this graduated increase allows the vessels around your system to widen so that there's less resistance for your heart to pump again. So that will graduate up the response to exercise. We do get a release of nitric oxide in the arteries, which causes the arteries to widen. So once you hit this 20 to 60 minute cardiovascular workout, you're in a good position with widened arteries, a reduced blood pressure compared to that if you did not warm up correctly. And also you're going to start your benefit point here at the very start of your conditioning component. During the exercises, if you recall from last week, you do get a release of noradrenaline and adrenaline, and so we do want to graduate it, slow down of exercise at the end so that you can get that actually self-absorbed and reducing the risk of an arrhythmia. So that concludes our introduction to blood pressure and exercise. We look forward to seeing you at the webinar. We'd like you to forward any questions you have on high blood pressure to info@h2hcardiacphysio.com, and we'll answer those questions at the start of the webinar on Thursday. We will then move into an exercise session, which will last approximately 45 minutes. We look forward to seeing you then. Thank you for your kind attention.